Hi, it's Patricia Coughlin again, and today I'm going to be continuing to talk to you about how to facilitate the deep experience of, in many cases, previously unconscious feelings that have been generating anxiety and symptoms. In the last video, we talked about how to help patients experience and in imagination, visual imagination, or what Davin called a portrait, their angry, rageful feelings and impulses. So remembering that whatever the feeling is, in order for the patient to be fully in touch with it, we want them to have the cognitive clarity, what they're feeling toward whom, right? The physical, somatic experience of that feeling, and then to get in touch with the impulses or the action tendency that accompanies that feeling. But we rarely would want to stop there. What we're really wanting to help patients do is to face, experience, and integrate all of their complex mixed feelings toward others, right? So we're not going to just leave it at anger, right? But to face the part of you that would want to hurt someone that you also care about, right, is going to evoke guilt-laden feelings connected, right, to your loving feelings toward that person. And we're typically enraged in response to some sort of hurt. So we want to help the patient experience the anger, the pain, the grief, the guilt, and then the love, right, so that they can integrate these feelings and in so doing also achieve, in a sense, a new perspective on self and other, right? That they can tolerate all of their own complexity and see and appreciate the complexity in the other person without being so anxious and guilty about these feelings, right? They're going to be better able to have lasting, intimate relationships with others. The other point I want to make, in addition to that one about really facilitating mixed feelings, is that you're always keeping in mind the nature of the presenting complaints and your understanding about the nature of the conflicts that are responsible for those complaints. So that if, for example, your patient has experienced some pathological mourning, right, then you're going to want to make very sure as you're processing the complex mixed feelings toward the deceased that you're also facilitating a goodbye, right, that this patient has not been able to do this thus far. So you want them to face and experience all their mixed feelings and then in a way to be able to say goodbye to this person. In another example, you might have a patient who's suffering because they have really internalized, let's say, a sadistic or neglectful parent, and they have been treating themselves in this way. That's a defense against them facing their feelings toward that person. So again, as we're helping the person face those feelings, we're also going to want to make sure that that internalization or introjection of that parent is getting ousted. I'll say oust the introject. So the killing is symbolic. It's a way to rid the patient of this internalized parent. So when you go to the burial, it's not just about burying that person, but burying this entire dynamic, right? Truly to be done with it and to free the patient of that internalization. So not only they stop treating themselves the way the other person treated them, but they're freeing themselves, right, to be loving and compassionate and to have healthy, loving, mutual relationships in the future. So those are the 2 points I really want to make in this video, that as you're working with feelings, you make sure you're getting to the complex mixed feelings toward others, and that you're doing this within a context of your case conceptualization, that we're always keeping the patient's presenting complaints in mind, and that we're helping them to get free of those and to replace those pathological, harmful patterns with something that's healthy. So I hope that's helpful. Again, please leave me comments, questions, and we'll continue our conversation. Thanks. Bye-bye.